Welcome to Creative Caregiving and Beyond. More and more people are having to become caregivers for their elderly loved ones, and navigating this journey can be really difficult. This podcast will provide guidance and give practical tips for your family. Your host is Wendy Whiteman, elder law attorney, author, speaker, and leading insight advisor in senior protocol and senior lifestyle trends. Know that you are not alone in getting the help that you need. Let's get started. And here's Wendy.
Well, welcome to Creative Caregiving and Beyond. And like many of you, I'm the caregiver for my mom, primary caregiver, and I'm always looking for good information. I am so excited about the show we have today. We have a special guest, Brooks Boyd with Senior Savings Organization. And Brooks is here with us today to decipher all the information that's out there about Medicare and Medicare enrollment. So Brooks, welcome to the show.
Thank you, Wendy. It's great to be here. I'm really excited about chatting with you today, and I want to thank you for inviting me.
Oh, it's a pleasure. It's a pleasure. I'm really excited. Now, Brooks is a native Houstonian, went to Texas Tech University, and but you have clients all over the state. Is that correct?
That is correct. I actually have clients not just in Texas, but from California to North Carolina, all the way up to Michigan, and a lot of the states surrounding Texas. So I'm not quite nationwide, but pretty close.
Oh, wonderful. Great, great. Well, that's great. It's just more people you can service. And so let's get into exactly, what is your position with Senior Savings Organization?
Wendy, I'm the owner of my insurance agency, Senior Savings Organization. We are 100% Medicare focused. That's all we do is Medicare. Medicare is confusing. It's not a one-size-fits-all plan, and I help folks navigate the maze of Medicare. I tell people my main job is to educate them so they pick the approach that feels right to them, and that can mean not doing anything at all, because a lot of times people are just looking for information. They're 64, getting close to turning 65. They see all these commercials on TV about Medicare, get the benefits that you deserve. They may be getting phone calls from all across the country by big call centers, trying to talk them into a plan that may or may not be the appropriate plan for them. They're getting their mailboxes stuffed with a lot of propaganda, and they're just overwhelmed. There's a lot of anxiety when people turn 64 and they get close to Medicare age. So what I do is I take folks through the process. I educate them on Part A, B, C, and D. I tell them what it covers, what it does not cover, what their options are to fill those coverage gaps. So that's really what I do in a nutshell.
Okay, well, we're definitely going to go through some of that for sure. And just for purposes of knowing when this is appropriate, when are the Medicare enrollment time periods?
Good question. And that's a very loaded question because there are a lot of different enrollment periods for Medicare. When you're turning 65, that is your initial enrollment period. That's the 3 months before you turn 65, your 65th birthday month, and 3 months after. You have a 7-month window to sign up for Medicare Part A and B. If you do not, well, then you will have a late enrollment penalty for Part B that will last you the rest of your life. However, if you continue to work and you have creditable group health coverage, you do not need to sign up for Part B. And it depends on the size of the company, whether you should sign up for Part A or not. If you work for a small company under 20 employees, well, then Medicare would be primary. If you work for a company that's 20 employees or greater, Medicare is secondary, and you do not need to sign up for Part B or A. Now, most folks sign up for Part A at that time unless you have an HSA, a health savings account. So in just the few seconds I just talked about one enrollment period, there are a lot of do this, if do that, if this, if that. So the moral to that story is there are a lot of rules and regulations and landmines that you must abide by when dealing with Medicare. Wendy, when I tell people that there is barely a day that goes by to where I don't talk to somebody who has either made a costly Medicare mistake or is about to, that's no hyperbole. It happens all the time, unfortunately. It's very confusing. But if you continue to work, you will have a special enrollment period once you retire and get fully on Medicare and enroll in Part B. But also, we are coming up on this fall, every fall, between October 15th and December 7th, the annual enrollment period for Medicare. What you do during the annual enrollment period every fall is you can change your prescription drug plan, that's Part D, or your Medicare Advantage plan, that's Part C. Part C, Medicare Advantage, those plans typically change every year, and that's when you can decide whether to keep your plan or maybe change it to a different plan that might have different or additional benefits. Maybe your particular plan that you had throughout the year, the networks changed. Maybe your doctor dropped out of that network and you now have to seek out a plan that does have your doctor in network. So that's just a couple of many different enrollment periods for Medicare.
Okay. Well, I'm glad you brought up the different types of Medicare. Could you give us a quick synopsis on the difference and what Medicare A, B, C, and D stand for?
Absolutely. So just in a Reader's Digest shortened version, that is Part A is going to be hospital insurance. Part A typically has zero premium. We've all been paying for Part A ever since we got our first paycheck and we wondered who FICA was. We've all been paying for Part A and still do if you're working through our FICA taxes. If you've been working in this country longer than 40 quarters, 10 years, you have zero premium for Part A. But that is hospital insurance. Now, Part B, to oversimplify it, is outpatient. Doctor's visits, surgeon's fees, CT scans, outpatient surgery, all that comes under Part B. Part D is prescription drug plans. Part D was created in 2006. Before 2006, Medicare did not pay for prescription drugs. Now they do. It's called Part D. And Part C, finally, is private Medicare, more commonly known as Medicare Advantage. That encompasses Part A, Part B, and oftentimes the prescription drug component, Part D. So what is Medicare Advantage? Because people confuse Medicare Advantage with original Medicare. I'll go into a little bit of detail on that. Medicare Advantage, Wendy, is private Medicare. It was created in 1997 by the Balanced Budget Act. Not everybody wanted to pay or could afford a Medicare supplement premium, so Congress created Part C, Medicare Advantage. You are no longer receiving your Medicare benefits from the government. You are now receiving it from a private insurance company. The government pays on average about $1,000 per enrollee per month to transfer that risk from the government to that private insurance company to manage that care for you. Lots of companies are in that space: Aetna, Cigna, Humana, United Healthcare. The list goes on. There's a lot of, you probably see Joe Namath on TV. You see these commercials starting about this time of year, just one after the other. Those, for the most part, are referring to Medicare Advantage. Typically, you'll have copays, coinsurance, deductibles, and a maximum out of pocket. It's managed care, so you have to stay within an HMO or a PPO, versus original Medicare Part A and B with a supplement. Now, there are big gaps in original Medicare. For instance, Part A, which is hospital, if you recall, When you go in the hospital, that's covered under Part A, and you will have for 2021 a $1,484 deductible. That's actually a per confinement deductible, which means you could conceivably owe that deductible multiple times throughout the year, separated by 60 days. It's a 60-day benefit. So that's a big gap. Also, there are copays after 60 days and 90 days, $371 copay per day after 60 days. However, that's the reason why these Medicare supplements, they're also known as Medigap plans. That's why these plans exist. They fill in the gaps of original Medicare. Plan G is probably the most popular right now. Plan F used to be, it's no longer available if you were newly eligible for Medicare as of January 1st, 2020. But Plan G is the most popular plan. That pays for all those deductibles and copays for Part A. Now, Part B also has a copay and deductible. For 2021, the deductible for Part B is $203. That's an annual deductible. But if you have a Medicare Supplement Plan G, it'll pay for the 20% that Medicare does not pay for. So after you pay your $203 deductible, Medicare will pay 80% of all Medicare approved expenses, and that supplement will pay 20%. The only thing that Plan G Medigap Medicare Supplement does not pay for is that $203 Part B deductible. So if you think about it, Wendy, if you have a significant health event like a heart attack, stroke, cancer, a severe car accident, that Plan G will pay for all the deductibles and copays under Part A and B, except for that $203. That's good coverage. In addition to that, there are no networks with original Medicare and a supplement. You go to the doctor, as long as that doctor accepts original Medicare and as long as that hospital accepts original Medicare, you can go there. And that's the vast majority of doctors and hospitals in this country. But you don't file a claim. When you go to the doctor, as you're leaving, you hand them your Medicare card. They file the claim with Medicare. If Medicare pays, that supplement pays. It's just that simple. Now, getting back to the Medicare Advantage side, you are now filing that claim with your insurance company because they're not filing the claim with Medicare. They're filing it with that insurance company. Those are the basic differences between a Medicare Supplement and a Medicare Advantage plan. So that covers Part A, Part B, Part C, and Part D, and then the Medicare supplements that typically go with original Medicare for that if you don't have a Medicare Advantage plan. So Medicare supplements are more common than Medicare Advantage, but Medicare Advantage is increasing its market share every year. They are becoming more popular. A lot of times those Medicare Advantage plans will include extra benefits like dental, vision, hearing. They'll include transportation rides to and from the hospital in certain situations. They have meal plans. These are good plans. You just have to know that a Medicare Advantage plan, Wendy, is a pay-as-you-get-sick plan. Typically, the Medicare Advantage plans are lower premium, lower cost, zero premium in a lot of plans, maybe $10, $20 a month premiums for some of the plans. But the trade-off is you're going to pay as you use that plan. You go to the doctor, you'll have a copay. Sometimes there's zero copays for your primary care physician visits. Specialists will have a copay, $35, $40, something like that. Mm-hmm. You'll have coinsurance, and you'll have a maximum out-of-pocket. Those plans are capped at a maximum out-of-pocket every year. If you're diagnosed with cancer, it's important to remember, on a Medicare Advantage plan, you will be paying about 20% of the radiation and chemotherapy until you hit your maximum out of pocket. As opposed to original Medicare with a supplement, once you pay that $203, you're done. So That's really the basic differences of Medicare Advantage and Medicare Supplement and the different parts of Medicare.
Well, Brooks, let me ask you this question. Now, with the Medicare, regular Medicare, and with Medicare Advantage, actually, can you have a Medicare supplement with the Medicare Advantage program as well?
That is a problem. You cannot. And that's an excellent question because people get confused. They think, well, I'm going to get a Medicare Advantage, but, I'm going to have a supplement as well. Number one, it wouldn't make any sense. But no, you cannot have both. So typically when you have a Medicare supplement, you have a prescription drug plan, and that will cancel out that Medicare Advantage plan. So no, you cannot.
Okay. Well, another question I get from clients sometimes, because a lot of my clients are dealing with the event of going into skilled nursing, and that the time frame that Medicare can cover will vary whether they have Medicare, regular Medicare, or an Advantage policy. So it can be very widely depending on, it could be 14 days coverage with Advantage plans. I've heard from clients where regular Medicare covers an outright 20 days. So it's something you kind of need to know and see what that plan covers.
That's true, Wendy. That is probably one of the stickier points on a Medicare Advantage plan. And I do get calls occasionally from skilled nursing facilities and folks that work with them saying, hey, can we get our person back on original Medicare? And it's not uncommon for them to disenroll from a Medicare Advantage plan just because the original Medicare benefits will pay better. It's a tricky situation, and it's unfortunately more and more common. So that's another reason to really take a look at your options and which one is going to work best for you.
Now, you mentioned sometimes they can disenroll. I've heard sometimes that can happen. Can they disenroll at any point in time if they're in a skilled nursing facility, or is it just during a certain enrollment time?
Well, there's only certain enrollment times you can disenroll from a Medicare Advantage plan, but when you're in a skilled nursing facility, there is a way to disenroll from the Medicare Advantage plan and get on original Medicare. It's not something I advise a whole lot. It can be a tricky situation. It's just one thing you want to be very careful for or about when doing so. Absolutely.
Okay, so they really need to look at their policy and see what they have and weigh those pros and cons before they do that.
Absolutely.
Yeah. What about the infamous donut hole regarding prescription drugs? And does that occur with regular Medicare versus an Advantage?
So another good question. The donut hole pertains to Part D, the plans, prescription drug plans.
Yes.
There are multiple different phases in a prescription drug plan. There's the deductible, the initial coverage phase, the coverage gap, aka the infamous donut hole, and the catastrophic phase. Part D prescription drug plans are notoriously convoluted and confusing. You want to know why? Because they're created by the insurance companies, and that's why. Just what happens typically during the donut hole is when folks go through the initial coverage phase. That's when we have these nice low copays. A lot of times for the tier, you have different tiers for different drugs. Tier 1 and 2 for generics typically, Tier 3 for preferred brands, and so on. So for Tier 1 and 2s, you typically have a $0, maybe a $6 copay for a Tier 2. Those are nice low copays. But if you're on some expensive brand medications and brand drugs in Medicare, as they are in under 65 health insurance, group health insurance, brand drugs are expensive. They're pricey. And it's the brand drugs that'll be subject to a deductible typically, depending on the plan. I mean, there are many different plans out there, and they're not all the same. Matter of fact, they're almost all different. It's very convoluted. But during the coverage gap, the donut hole, that's when you've spent through a certain amount of money, a little over $4,000 on retail drug costs. And that's when those nice low copays, the initial coverage phase, goes away, and you will be paying 25% for retail for both your generic and brand drugs. And that lasts for a little while, and then you'll get to the catastrophic phase where you pay 5% for your drugs. So I tell folks, look, if you're on a brand medication, and for my clients, I run a prescription drug plan review every fall. Come this October, I'll be doing it for all my hundreds and hundreds of clients.
Okay.
To see if what the particular plan that they're in, if that's the most appropriate and applicable plan for them to keep for the following year, or if there might be a better plan for them. Maybe there's a plan out there that avoids the donut hole for whatever reason, because it pays for the brand drugs a little bit better. But that's the donut hole. It's not as onerous as it once was, but it's still painful. And a lot of times folks will spend a couple of months in the donut hole and then exit it. And typically along around September or October is when people start getting into the donut hole. And I start getting phone calls going, well, why is my medication so much more right now? Because folks forget. I mean, this stuff is complicated.
Yes.
And that gets back to, don't try and do this alone.
Right.
Work with a specialist. I am a specialist. I eat, live, and breathe this stuff 24/7. Medicare is all I do. Remember earlier when I said there's barely a day that goes by where I don't talk to somebody who's either made a costly Medicare mistake or is about to? It's the truth. So one of the things that I do for my folks, Wendy, is, like I said, I review their prescription drug plans every year. I shop the market for all the different plans. I'm an independent broker.
Okay.
I do not work for an insurance company. I work for my clients. Okay. I do not charge a consultation fee. I'm compensated by the companies that I represent should someone choose to become a client of mine.
Okay.
And when they become a client of mine, I become their Medicare advocate from here on out. Okay. Anytime they have a question about anything that's Medicare related, they can pick up the phone, call me, they can text me, they can email me any way they want to. So I'm always there for my clients. So I know all the different carriers, what they look for, the rate trends. I look for the carriers with a good track record of rate stability. Getting back to Medicare supplements, Wendy, these Medicare supplements are standardized plans by the government. In other words, a Plan G is a Plan G, whether it's with United Healthcare, Aetna, Blue Cross, Mutual of Omaha, Lloyd's of Luckenbach, you name it, they're all the same plan. Now, where they differ, number one, is in price. Not all of them, they're not priced the same. Okay. You'll have one carrier that has, maybe a Plan G for a female turning 65 for $101, but and it'll the range will go all the way up to close to $200 or more. Okay. Now, do you automatically pick the cheapest plan? Well, not necessarily. Some insurance companies will come into a market and they're brand new and they want to buy market share. How do they buy market share? Well, they do that by coming in with really low rates. Hey, that looks good, but they may raise those rates quite a bit 2, 3, 4 years down the road, where it might make sense to get a plan that's, a few dollars more, but it's been in the market for marketplace much longer. Mm-hmm. And, their track record of rate stability is much greater.
Yes.
So yes. Their history is more known than typically maybe a new one in the market. I hope that makes sense.
No, that does. It makes perfectly good sense. What if someone wants to change their plan? How do they notify their previous company if they've had an Advantage plan and they want to go to regular Medicare, or if they had an Advantage plan and they want to go to a different Advantage plan? How does that work? Do they have to call the other company or call Medicare, the government for regular Medicare, and say, hey, I'm going to change it? Do they have to do all that legwork themselves, or how does that work?
Well, that's a good question. It depends. So if they're going from one Medicare Advantage plan to another, let's say during the fall annual enrollment period,
Yes.
let's say they're going from Blue Cross to United Healthcare, or just pick a couple of companies. That change will take effect January 1st of the following year. And that they will be disenrolled from their current plan and enrolled in the new plan as of the first of the year.
Okay.
So it's done automatically. They do not have to be proactive and do that.
Okay.
Now, if they're going from a Medicare Advantage plan to a supplement, they'll have to enroll in the supplement. They'll typically require underwriting, which means answer health questions,
Okay.
unless there are a few caveats to where they don't have to do that. But once they enroll in a prescription drug plan, that will automatically disenroll them into that Medicare Advantage plan. So typically, it's done automatically. Now, let's talk about the reverse. What if they're going from a Medicare Supplement to a Medicare Advantage plan?
Mm-hmm.
Well, they will have to proactively contact their Medicare Supplement carrier, their company, and stop the payment and cancel that plan once the Medicare Advantage plan is effective. So, and then, getting back to the different enrollment periods, we have our annual enrollment period between October 15th and December 7th. So, but there's another open enrollment period, January 1st to the end of March, to where they can make some, not all of the changes they were allowed to make during the fall, but just some of the changes. So if they got into a Medicare Advantage plan and wanted to bail out back to original Medicare and a supplement, they could do that, or change to another Medicare Advantage plan during that first 3 months of the year. So there's a whole lot to know and think about. And I tell my clients, Wendy, I said, listen, when I talk to them and take them through my process, I tell them, look, I cannot expect you to retain everything, just like this podcast that we're having here. I can't expect folks to retain everything that we're going through.
Right.
That's really not the purpose.
Right.
The purpose is to expose people that, number one, Medicare is confusing. There's a lot of landmines out there. There's a lot of rules and regulations out there. Work with a specialist. I am a specialist, and if folks are interested in working with me, you can go to my website, seniorsavingsorganization.com, and go on that website, and it'll have all my contact information on there for folks that are interested in, maybe just have a question or two that you want answered. I'm more than happy to do that for folks as well.
Oh, that's great, Brooks. And I can attest to that because as an elder law attorney, I do a lot of Medicaid filings, but I know virtually nothing about Medicare. And I was scratching my head when I was helping my mom enroll into some programs. It's just so much. There's no way you can know it all unless you specialize in it. And so when would you suggest, because October is right around the corner, when would you suggest someone get started in exploring what their options are?
October 1st is when you can start talking and engaging with a Medicare specialist such as myself. No applications can be taken until October 15th.
Got it.
And then that lasts again from October 15th through December 7th. It's just a short window. It's over before you know it. And I always encourage folks, look, sooner rather than later. Don't wait till December 6th because I do get calls on December 6th and 7th. So don't wait, don't delay. Work with your specialist. If you want to work with me, I'm more than happy to work with folks. So absolutely, don't delay. And that also goes to folks that are turning 65. Don't wait until the last moment to sign up for Medicare if you are going on Medicare when you turn 65. You enroll in Medicare by going to the Social Security Administration website. There are times during the year where the Social Security Administration is backed up. I know it's hard to believe, but the government sometimes will delay the process because, it's the government. And so I tell folks, look, if you know you're going to have a target date for doing this or that, make sure you you do it in a timely manner and work with somebody who's going to guide you through that process.
Yes. Well, I totally agree with that. And so our viewers can contact you October 1st to try to figure out this maze of Medicare and which plans are best for them. And I'll be probably calling you too. So for my
that's a
family
good
members.
question you bring up. As an elder law attorney and you deal, with Medicaid, there are special plans for folks on Medicaid and Medicare. They're called dual plans, Medicare, Medicaid plans. And they're very, very good plans. And they really pay for all the copays, coinsurance, deductibles, maximum out of pocket. So they're very good resources for folks on Medicaid.
Oh, very good. Very good. So, I have a lot of clients that are in not skilled nursing, but long-term care, and or they may be at home with home health care. So they can change those as well yearly to meet their needs too and make sure they're in the right plans.
Absolutely, they sure can. And, unfortunately, Medicare does not cover long-term care insurance. There's been talk in the legislation about adding that. I would not hold our collective breaths for that to happen.
Right.
There are other benefits that they're talking about. Dental and vision is one of them. We'll see if that happens. But folks that, they're still young enough and healthy enough to look at long-term care options, they really should. But yes, so Medicare does not pay for that. It does, as we alluded to earlier, pay for short-term skilled nursing facilities. But that's only a temporary situation there. But yes, good point.
Well, great. Well, Brooks, I've so enjoyed having you on, and I will definitely want to make sure we get all your information and put it on this podcast so everyone can contact you. And I know it's going to be a wealth of information and wealth of help because it's so stressful trying to figure out everything that's going on. I've done it myself with my mother, and I'm like, I'm done. When I heard about you and I heard you speak the first time, I was like, I've got to contact him so I can get some help myself. So I know it's going to be helpful for everybody else as well.
Man, Wendy, you're so right. Once again, thank you so much for having me. I really enjoyed it. I'm here to help folks just like you are in your profession. And that's, I think, what it's all about is just making sure folks are taken care of and not advantage of.
Well, Brooks, what is your website or contact information? And we'll definitely make sure we put it up as well.
Yes, the best way to contact me is going to my website. All my phone numbers, email address is there. And that website, Wendy, is www.seniorsavingsorganization.com. That's all one word, seniorsavingsorganization.com.
Great. SeniorSavingsOrganization.com. So if you decide to contact Brooks, tell him that I sent you, and he's going to definitely make sure you're taken care of and get the right plan that you need for your family and for yourself. So thank you so much for watching, and don't forget to like our channel on social media and subscribe to our channel. Give us a thumbs up if you've liked the information that you've heard, and don't forget to check in on the senior, because it just might brighten your day.